In this video, I'm going to show you how to self-treat shin splints with massage, stretches, and exercises. Shin splints are commonly found in runners, and the pain is experienced along the muscles that attach to the lower leg bone, the shin bone, or it's also called the tibia. The pain can be on the outside of the tibia in a muscle called the tibialis anterior, which is the most common in my practice, or on the inside of the lower leg in a muscle called the tibialis posterior. And there's also a common trigger point at the top of the tibialis anterior that shoots down to the toes at the point of the acupuncture point ST36. To massage the tibialis anterior, that muscle on the outside of the shin, you could use a foam roller, but I'm going to be using my Theracane. You want to just start from the top and then push down. And I have a combination of oil and lotion so that it slides smoothly. And if anywhere along this sliding you feel some tightness, just flip the Theracane over and go ahead and get in with the ball of the Theracane, and you can massage pinpointed areas. Remember I was telling you about ST36, that acupuncture point that will cause trigger points down to the toe? This is where it is, and this is how you massage it. And you might even find some other acupuncture points. This is stomach 37 right here that can also cause some referrals. And massage back and forth all the way down that muscle. And so the tibialis posterior is right here. And once again, I could use the outside of the Theracane just to do some general, what they say in massage, effleurage. You can push pretty hard in here as well. And if you find some pinpointed sore spots, you could use this aspect of the Theracane or this little knob area right here. And just work all the way down those tight areas. To massage the tibialis posterior, it's a smaller muscle, so you can just use the main knob, drop off the shin to where you feel flesh, and then just stroke down the muscle like so. You might find this one a little more sensitive because it's on that inner leg. And when you get to any area where you're feeling maybe a trigger point or a tight spot, you can just stop and hold in that area for 30 seconds. To stretch the calf muscle, you can use resistance bands, but I prefer to use the Theracane. So what you want to do is wrap the resistance band or the Theracane around the ball of the foot and just pull it towards you, bringing your toes to your nose. And as you'll see in a lot of my videos, I really love doing stretching with resistance, and we're going to do that here as well. So for resistance with this, you're going to be pushing against the Theracane, but you're not going to be changing the range of motion. So push for 10 seconds. Relax. Pull up, bringing the toes to the nose. Once again, push for 10 seconds. Resisting the stretch, relax, and then just pull the toes towards the nose again. To stretch the tibialis anterior, you're going to put your hand on your toes and then just push down. And once again, if you want to create resistance with this stretch, just push up against your hand in this direction without changing the range of motion. So push for 10 seconds, relax, pull the ankle down, push for 10 seconds, and then relax and pull down again. And then push once again up against the hand. 10 seconds, and then relax and pull down. To strengthen the calf muscle, either again the resistance band or the Theracane, put it right at the ball of the foot and then push down. Relax all the way up. And so you can push just in static or kinetic motion. All the way down, resisting down. And you can even try bringing it back, resisting as you come up. And then push down. And then resisting as you come up. And then push down, resisting, and then also resisting coming up. To strengthen the tibialis muscles, there's two ways you can do this. Place the theracane on the top of the toes and then lift up all the way up with resistance, and then as well go down with resistance. Lift up with resistance and down with resistance. Or you can put your leg across the body, place the theracane here, push up against resistance, and then down against resistance. Up against resistance, and then down against resistance. And do all these for approximately 30 seconds to a minute. These stretches and exercises can also be done standing. So to stretch the calf muscle, bring back the affected leg, straighten it completely, then bend the forward leg into what's called a lunging stretch. Hold this for about 30 seconds, and then you can switch it, bringing this other leg back, straight, completely locked out, and then bend the front leg, and you should feel a really nice calf stretch. If you really want to up this stretch, you can bring a book, put the toe on the book, and then keeping this leg perfectly straight, come forward. And you're not going to be able to go that far forward because by lifting up the toes, it really creates a pretty intense stretch. And then we can switch, put the other toes on the book, straighten that back leg completely, and then bend forward. And you're really going to feel that stretch. And that's, once again, is to stretch the calf muscle. To stretch this front muscle, just put your toes on the ground, like so, and bring your toes back in this direction to stretch. And then we can switch sides, toe, and then stretch. To exercise these muscles, it's so easy. To exercise the calf muscle, you just come up on your toes. And then to exercise the tibialis muscles, just bring your toes up. And you can even have fun with this. You can walk with your toes up and then walk back on your tippy toes. Walk forward on the heels of your feet and then walk back on your tippy toes. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos.